In today's evolving landscape of preventive care and women's health, one important and frequently asked question remains central to personal wellness routines and clinical guidelines. How often should women get a pap smear or pelvic exam? The answer depends on age, medical history, and individual risk factors, but modern recommendations from leading health organizations in the United States offer clear guidance designed to balance early detection with personalized care. A pap smear, also known as a pap test, is a screening procedure used to detect abnormal changes in the cervical cells that may lead to cervical cancer if left untreated. It's a cornerstone of preventive care in women's health and has played a critical role in reducing the incidence and mortality of cervical cancer in the US over the last several decades. In contrast, a pelvic exam is a broader physical examination of the reproductive organs, including the vulva, vagina, cervix, uterus, and ovaries, while the pap smear specifically screens for cervical cell changes. The pelvic exam is used to evaluate a range of potential concerns, such as pelvic pain, unusual discharge, or irregular bleeding. Current guidelines from the American College of Obstetricians and Gynecologists, ACOG, and the U.S. Preventive Services Task Force, USPSTF, recommend that women begin receiving pap smears at age 21. Regardless of sexual activity, between ages 21 and 29, most women should have a pap smear every 3 years, assuming prior results are normal. During this time, co-testing with HPV, human papillomavirus, testing is not typically necessary unless there are abnormal results. From ages 30 to 65, women have more than one screening option. They may choose to have a pap smear every 3 years, or opt for co-testing, a combination of pap smear and HPV testing, every 5 years, which offers a longer screening interval while still providing effective detection of cell changes and high-risk HPV strains. HPV is the most common sexually transmitted infection in the US, and persistent infection with high-risk types is the leading cause of cervical cancer. This makes HPV testing a valuable tool in long-term screening strategies. For women over 65, routine pap smears may no longer be necessary if they've had a consistent history of normal results over the previous 10 years and no history of high-grade cervical dysplasia or cervical cancer. However, discontinuation of screening should be determined in consultation with a healthcare provider, taking into account personal medical history, risk level, and prior test outcomes. Pelvic exams, on the other hand, do not follow a strict schedule like pap smears. The frequency of pelvic exams varies based on symptoms, concerns, and the guidance of a primary care provider or OB/GYN. In the absence of symptoms such as pelvic pain, abnormal bleeding, or discharge, a routine annual pelvic exam may not be necessary for all women. However, many healthcare providers continue to offer them as part of an annual wellness visit, especially for individuals with a personal or family history of gynecologic conditions. Women with specific risk factors, such as a history of cervical dysplasia, immunocompromised status, exposure to diethylstilbestrol, DES, in utero, or prior abnormal pap results, may require more frequent testing. For these individuals, more personalized screening intervals are developed in collaboration with their healthcare provider. In such cases, both pap smears and pelvic exams may be scheduled more regularly to ensure early detection and timely intervention. The goal of these updated screening guidelines is to ensure that women receive appropriate care without over-testing, which can lead to unnecessary procedures or anxiety. Evidence-based timing reduces the risk of false positives while maintaining vigilance against serious conditions like cervical cancer. This reflects a broader shift in American healthcare practices, which increasingly emphasize personalized, data-driven preventive care that supports long-term wellness without adding unnecessary clinical burden. For younger women under 21, pap smears are not recommended, even if they are sexually active. This is because the risk of cervical cancer in this age group is extremely low, and most HPV infections in young women clear naturally without intervention. However, sexually active individuals should still engage in routine sexual health screenings, HPV vaccination discussions, and education on safe practices with their provider as part of a comprehensive reproductive health plan. Beyond cancer screening, pelvic exams may be recommended at any age if symptoms arise. Women experiencing pelvic or abdominal discomfort, changes in menstruation, unexpected spotting, or other reproductive concerns should consult with a healthcare provider. A pelvic exam, in conjunction with imaging or lab tests, can help determine the cause of symptoms and guide appropriate treatment. Technology has also advanced cervical health screening, liquid-based cytology, enhanced HPV genotyping, and self-collection tools are under continuous review for their potential to increase accessibility and accuracy. Telehealth platforms are helping more women access information about when and how to schedule appropriate screenings, especially those in rural areas or underserved communities. Many American healthcare systems are integrating reminders into electronic health records and patient portals, helping individuals stay on top of recommended screening schedules.